Okay, so when we're checking the hyoid, the reason that you're going to check the hyoid is primarily that somebody is going to be having neck problems that aren't resolving, so it's process of elimination. Usually you get most of what you need by just checking the neck in a macro sense most of the time. If you have to zoom in on the hyoid, often a neck issue isn't resolving, or the person has a complaint of things like swallowing issues, right? Then it makes a little bit more sense to zoom in here. This is not something you have to check often. In a seated position, it's most exposed. Based on where I'm going to be, it's maybe harder to see, so I do have to rely a little bit more on looking at my hands and also the sense of palpation. Generally, not generally, you're going to use the hyoid as a handle. You're not perfectly going to be on the hyoid. You're just going to be on the firm stuff in the middle. So cricoid, hyoid, thyroid-ish stuff, the stuff that hangs in the middle, because all of your strap muscles, your supra and infrahyoid muscles will attach there. So this is actually an area where you want to be careful about how much general contact you have, because it will feel like you could be choking the person because you're coming to the midline of the neck. So if I do this, it can feel really choky, right? And I'm also putting a decent amount of pressure on the SCM. It may not feel like that to everybody, but you're better off to assume that it feels like junk to everybody, right? So in this case, SCM medial, there will be something firm. It won't be perfect. And you're going to slide it and slide it, right? And you're just looking for how far it will go. Now you can't just stop where you want to. So if I tested like that, you cannot trust me, right? Some of you see that, some of you don't. I need to move it until it stops. Move it until it stops. Now, can any of you see that it will go this way relatively easy, and it just doesn't do that well, right? So we're able to assess it. I look at what my hands are doing. I feel what my hands are feeling. So it's multisensory integration. Keep your eyes and your hands on the prize, right? Or your hands and your eyes on the prize. That sounds better. Now, the other way that I can do this, and the other way that you will see this, is sometimes people will be sitting and sometimes they will be standing. I will suggest to you that if you come off to the side, do not sit. The reason you don't sit is because you're more likely to do this dumb stuff, right? You're more likely to rest. So how many of you remember from any form of life-saving or any form of pulse checking, you don't check over the other side, you check on your side for pulse, so you don't accidentally choke them, because under a lot of circumstances, you won't pay the right attention. So if you're sitting, you can do this, right? But it doesn't feel as comfortable. It's a little bit more likely to be biased in how you do it, because you're on one side, one movement is easier for you to do than the other. If you're gonna do it here, you stand, because now you can see it, right? Now, if I was to ask you which one was the most comfortable, was it up here or either one of these?
Up here.
Yeah, up at the top of the table. It's just a little bit more comfortable. It's not as small in the hold because the thumb side is going to be small. It's just much more comfortable to be at the head of the table and move like this. You have to be careful what the rest of your hand is doing. So you actually usually have a high hand, so you're not all over the neck. But this is where the thing that you're looking at is not the structure itself or the thing you're trying to move. It's your hands and how far your hands go. That's what you look at. So you feel the restriction to the motion, but you look at your hand because her chin happens to be in the way. I really don't want to do this because she's going to breathe right up my nose and I'm going to breathe right down her face. It's very uncomfortable, so we don't do that.